For more on the vaccinations in Cross River State, Dr. Janet Ekpeyong, DG, Cross River State National Primary Healthcare Development Agency, joins us on the program via Zoom. Thank you for joining us.
Thank you very much for having me.
Tell us, how is vaccination progressing across the state? Are there any challenges with the rollout?
Oh, yeah. Okay. Cross River State rolled out its vaccination on the 19th of this month. And initially when we started, there was a lot of hesitancy from even health workers. But I'm glad that as the days progressed, the demand for the vaccine has actually increased. Currently, about 20,000 Cross Riverians have been vaccinated so far. And we are very pleased with the number and the high demand for vaccination. So we are very happy with the numbers so far.
In terms of the hesitancy you mentioned, because we know that in terms of the phases, you have frontline health workers. So based on the number you've talked about, I want to believe that those are frontline workers and maybe the politicians. Are there security involved? And this is before the larger Cross Riverians. And I'm asking this because there's still quite a number of people who are really hesitant to take in the virus. So is there public education, enlightenment that's going on while you, of course, roll out the vaccination in the phases as it's meant to go?
Oh, yes. So in the course of this exercise, we've actually had to engage with a lot of people, including health workers, because honestly, health workers as well, they were all hesitant, in taking the vaccine. But with continuous engagement, continuous sensitization, education, and constantly engaging them, I think we've been able to do at least convince a lot of them to actually take the vaccine. And since the first person who took the vaccine is still very much alive, that has actually given a boost also to our people accepting to take the vaccine. So health workers were also a problem, other frontliners as well. The police, the Navy, and several other force, military and paramilitary organizations, including teachers. There was that hesitancy initially, but I'm glad that so far there's been acceptance and the numbers keep increasing every day. I think the major challenge we have currently is because of the e-registration, which is not only peculiar to Cross River State, because a lot of states are actually experiencing this as well, because of our terrain and all that. But so far, I'm actually very impressed, and of course, we are not relenting on constant engagement, providing all the necessary information, education, and communication to ensure that everyone who is meant to have this vaccine in this first phase is actually, get vaccinated. So we want to ensure we cover all frontline workers in Cross River State, and I'm glad with the progress we've made so far.
Dr. Ekpeyong, you just mentioned about 20,000, over 20,000, but just getting an update, and this is from the National Primary Healthcare Development Agency, and it says for Cross River that the state has only vaccinated about 1,840 people, which is about 3.4% of the target. So how do you reconcile all of that data?
Okay, so that's the major challenge that most of the states are actually facing right now, because you need to do e-registration and, of course, verification as well. And because of how Cross River State is, we have very difficult terrain where there's no network, and you must make sure that as you capture these people in those communities, you have to travel all the way to where you can actually get network to see how you can upload all the information to the dashboard or to the database. So that has been a huge challenge most of the states in Nigeria are currently having, and I'm hoping that the federal government can also help us in that aspect to see how they can reconcile this as well nationally and ensure that all the bottlenecks and make sure it's not so cumbersome, because a lot of people have had to travel all the way just to see how they can get information to database. But we'll continue to try, because currently what we have on ground is that about 20,000 people have been vaccinated. But in terms of capturing them electronically, That's where the challenge is, and we're working to see how we can reconcile the data we have of those vaccinated with that captured on the dashboard.
All right, a very important strategy. We'd like to thank you, wish you all the best in your efforts. Thank you so much, Dr. Janet Ekpeyong, DG, Cross River State National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you very much for having me.